So talking about IVF and IUI, ma'am, what percentage of couples walking into an IVF center or an IUI center do actually have the potential to conceive naturally, and in what cases do you absolutely need an IVF?
See, unless and until you have no eggs or no sperms, these are the only conditions that need high-end treatments. Otherwise, from my experience, what I feel is at least 85% of people who are walking into any IVF clinic can be given a chance of transformation of their lifestyle or what their living pattern is, and give a good trial for natural pregnancy.
Wow.
Because anything and everything which is acquired as a problem can be solved as a treatment. So the philosophy of correction, if applied very well, then normalcy is something that they eventually have to get.
Right.
When you become normal, you conceive normally. So 85% of people who actually are having fertility issues can solve their problems by sitting and just understanding what is going wrong. And there is a definite amount of 10 to 15% where corrections are not possible to an extent to achieve natural pregnancy. So they can be pushed for IUIs or IVFs or other high-end treatments, which definitely they will need if it is not a correctable problem.
So we received a question from one of our couples, ma'am, where they had to go for an IUI first and that failed, and then they had to go for another IUI that also failed, and then they were suggested to go for an IVF and that failed as well. So going for one treatment after the other, is that the correct way to go about things? Should they continue it this way, or is there anything else they should look at?
Actually, they should stop and understand why there was a failure. Understanding failures is something that not everybody does. If you understand your failure, why? Is it egg quality or sperm quality or the environment or the lifestyle, or is there anything else to it? Pause yourself and question yourself. You will definitely get the answer. And this way, if you don't correct your quality and if you don't correct what is wrong and you just move on for treatments, upgrade yourself with other treatments, the same failure will come there. I'm going to give you an example. See, if you have both tubes blocked, what else is there to do? You have to go for an IVF if both tubes are blocked. There are people who thought that there's a block and they went to doctors where they removed the block and they tried multiple times, eventually not knowing that there was a reason behind tubes getting blocked, which came back again and blocked it, and they were constantly doing IUIs so that they will improve their results, but it did not happen because the tubes blocked again. So tubes block not because of a physical problem only. Tubes block even with stress.
Oh my God.
That is spasm.
Yeah.
It's an inherent mechanism in your body. Somebody is coming and trying to hit you, you put your hand, right? In a similar way, if you are stressed out, for the results, if you are stressed out for the condition that you are living in, if you are stressed out that you are childless, that itself is a thing that can go into spasm. Spasms need not be blocks, but they always block, right? So there are certain things in such way also impacting. So when there is absolute tubal block, you go for IVF, it will click. Your problem is not quality at that point. Your problem is blockage. So those kind of problems get addressed with IVFs. And also, if your sperm count is too less, improve the quality. If the count does not improve, if it is still less count, or if it is a sperm that is taken from the testis, you have to go for IVF. You have to go for it. You have to go. But if any other condition, whether it is low motility, low number of sperms which is correctable, or any hormonal imbalances, or egg that is releasing but yet not getting pregnant, you should look around the environment. So unless and until you correct environment, you will not have success in any high-end treatments also, because the one thing that you're not correcting is quality.
So you would suggest that if somebody is having multiple failed treatments or they're having a lot of difficulty, they should pause for a couple of months and actually fix their lifestyle first?
Of course, yes.
Okay.
Because if you don't fix your lifestyle,
Right.
it will haunt you during pregnancy also in terms of complications, and post-delivery also in terms of complications in the baby,
Okay.
which people are not understanding.